Good afternoon, everyone. This is State Representative Harold Love Jr. I'm also the president of NBCSL, along with serving in the Tennessee State House representing House District 58. NBCSL is the premier organization dedicated to empowering African American state legislators across the country. Thank you very much for joining us today as we discuss public health across America. What is public health? Public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with protecting the health of the entire community. These communities can be as small as your local neighborhood or as big as the entire country. I thank you again for joining us today, and I will now turn it over to our moderator who will introduce our panelists.
Thank you, President Love. Good afternoon, everyone. My name is Crystal Knight, and I will be moderating our event. We have an esteemed panel of state legislators and public health leaders joining us today. I will now introduce each of them. First, we have Delegate Sia Price, who represents the 85th District of Virginia, which includes the city of Newport News. Delegate Price is a member of the Virginia Health and Human Services Committee and is the chair of the state's Health Professions Subcommittee. Delegate Price also serves as the chair of the Health and Human Services Committee for the National Black Caucus of State Legislators. Next, we have Representative John King. John King represents the 49th District of the South Carolina, which includes the city of Rock Hill. Representative King is a member of the South Carolina Ethics Committee and Judiciary Committee. Representative King is also an at-large leader of the National Black Caucus of State Legislators. Next, we have Jasmine Hooper, who serves as the Equity Strategies and Partnerships Manager for the American Heart Association's Voices for Healthy Kids, where she works to build and strengthen partnerships that advance policies supporting early childhood development, maternal and child health, and family economic security. And then finally, we have Kaylin Tanner, who is the Deputy Director of State Strategies at All Above, where she leads state-level engagement for reproductive justice. Welcome to all of our panelists. Let's start with the current landscape of public health. There have been a number of recent executive actions that have impacted public health. The implications of these actions stretch beyond the federal level and can be felt all the way down to state and local health departments and into local communities. How has the current public health landscape impacted you and your work? And I'd like to turn to Delegate Price first. Can you talk? Oh, go ahead.
No, I was going to thank you for the question because I think when you're creating chaos, it's very hard to have health. And Representative Love established a comprehensive definition of what public health is. So a lot goes into creating an environment where people can have healthy lifestyles. So even if we look at the most basic, like Maslow's hierarchy of needs, when we're looking at level 1 of basic needs of food, water, and shelter, a lot of the executive orders were targeting that. But if you can't even afford food for your family, it's really hard to think about the next layers of health. And then if you go to level 2 and it's like security, stability, freedom from fear, we're just in an environment right now where health is hard. It's rough out here. But I think as a legislator, thinking about the housing crisis, thinking about food insecurity, before we even get to potential cuts of Medicaid and Medicare, these are really, really important conversations that we're having, especially when we can also think about the mental health impact of what a country's constitutional crisis is doing to the mental health of marginalized communities. But here in Virginia, if we want tangible examples, we just got our community health workers fully up and running and funded and excited and making a dent into some of the health disparities that we have, that we know, right? That we have numbers that show their health disparities, and attacking some of those underlying issues like transportation in order to get to the doctor, or childcare in order to get to the doctor, or even our Black maternal health crisis that we have here in Virginia. But when you cut at the federal level, COVID-19 recovery funds, that reverberates down to the local health department. And one of our Blackest and poorest cities, their community health worker department got decimated. And so, and other positions that are meant to address these underlying issues of the health disparities are being attacked as well. But you only even get to a policy that addresses a health disparity once you know the health disparity exists. So then you have to think about, if we have a governor that's trying to suck up to the president in an anti-DEI manner, and now we're not even collecting the data that allows for us to show differences between what our Black neighbors and what our white neighbors are experiencing, then the policy decisions that the legislators are making, we're in the dark. We can only go with anecdotal stuff because we know our communities. But when we're looking at funding, if we're cutting funds, we are headed back to pre-ACA and even further back. And so that is quite dangerous. So, as a legislator, and I'm sure my colleagues as well, as a legislator, we want to go into, how do I pass legislation to help somebody thrive? And now, honestly, at the state level, we passed the budget on hope, because we passed the budget on a whole bunch of federal funding that, after the budget passed, we're now finding the federal funding is not going to be there. So we're going to be back in special session, and we won't be able to focus on that next level, a tier of thriving. We are now going to be, as state legislators, having to decide where we can fill the gaps, where we can't, and trying to minimize the death toll, as opposed to actually getting some of our communities to thriving. And that is a hard pill to swallow as a legislator.
Got it. Thank you so much, Delegate Price. Are there others who'd like to just chime in around how has the current public health landscape impacted you and your work?
Well, as a state rep in South Carolina, the current public health landscape is deeply concerning. We're seeing executive actions at the federal level that trickle down and roll back funding on the state level. In South Carolina, these ripple effects are real, whether it's maternal health disparities or sickle cell disease or access to preventive care. We're seeing it in South Carolina. I have a sickle cell program that I've, what we call as our pet projects in our districts, that will not be funded, that has been funded for the last 10 years at almost $1 million each year, that just covers my county. But because of what's happening at the federal level, it mirrors here in South Carolina, because we are a state that is ran by the same party that runs the federal government. And so what happens on the federal level, they're duplicating it in the state, even if the federal has, how do I want to say it, has not eliminated funding, or if they have eliminated funding, but it did not adversely affect South Carolina, they're going in and doing the same thing that the federal government is doing. So if it's something that we are not receiving from the federal government, I'll make it like this, and we have not been receiving it from the federal government, South Carolina is still going in and mirroring the federal government, if that makes sense. And so they're cutting out programs. This year, they have cut out any funding that members of the General Assembly usually request for their district, which will adversely affect, because most of us are doing things in our district that impact communities that look like us. So those funds will not be there. And so that's what we're seeing from what's happening at the federal level to the state level.
Got it. That's helpful. Oh, yes, Caitlin, I see you coming.
Yes. I like to chime in as well. So at All Above All, we work to advance abortion justice through a reproductive justice lens. That means we're not only tracking the executive actions at the federal level, we're also deeply connecting to how those decisions ripple out and impact people, day to day. So, especially in the states where abortion access and broader reproductive health care are already under attack. So, getting to these recent rollbacks, federal rollbacks, court rulings, and administrative shifts like ongoing threats to mifepristone access or the erosion of Title X protections, they have had a chilling effect on the ground. So, these actions have fueled confusion, created additional stigma, and have made it even harder for our state partners on the ground to do their work, whether they're advocating for Medicaid coverage of abortion or fighting just to protect basic reproductive care in their communities. So what we're doing, we're talking about a lot of these issues, right? But what we're doing in response is pretty twofold. First, we're equipping our partners with the tools they need to navigate and push back against these barriers. That includes our abortion justice policy playbook, which outlines proactive, people-centered policies that states can adopt right now. Second, we're creating space for cross-state collaboration and strategy, helping local organizers, legislators, and community members learn from each other and build collective power to pass comprehensive legislation that's going to help the most marginalized communities that we need to center. And lastly, because ultimately we believe every level of government has a role to play, right, in shaping public health, we are deeply committed to ensuring that our communities aren't just included in the conversation, but are leading it. They shouldn't just be impacted by policy. They should be actively informing and influencing the policies that shape their lives and futures. So that's some of the work that we're doing at All Above All today.
Thank you so much, Kaylin, for sharing that. And I want to get Ms. Jasmine in on this conversation. What role do parents play in child health, and how can organizations like yours support them?
Well, thank you for having me today. And parents across the country want to give their babies and toddlers a strong start, but we know that the cost of everyday living is overwhelming. Supporting parents is a smart investment, and we know that research shows that every dollar spent on high quality early childhood programs has a $10 payoff that strengthens families and bolsters local economies. So across the country, state and federal programs help provide families with essentials like nutrition, childcare, and healthcare so parents can give their children the best possible start. But those supports are unfortunately under threat right now, and it's putting our babies and our toddlers at risk.
Thank you so much. And I want to get in on the original question too, on how the federal actions are impacting the work at Equity Strategies, at the American Heart Association. Are there any learnings that you are adopting based on these federal actions that are coming down from the White House?
That's a good question. Well, I will say, I echo everyone's sentiments. These cuts are devastating for our community. And at the American Heart Association, we are really focusing on the cuts that are underway to Medicaid and Medicare, and we're really focused on healthcare access. So at a time when families are struggling to keep up with rising costs, we can't afford policies that would raise the cost of healthcare. That is what we know. And there are proposals that are moving through Congress that would cut up to $880 billion from Medicaid and terminate tax credits that would make insurance premiums affordable for working families. So what we know is that these cuts would take away health care for millions of people, millions of our people and our children. And as a result, many people will be uninsured and face mounting medical debt and be forced to delay care. So what we know at the American Heart Association is that these haphazard and reckless cuts to Medicaid will do nothing to lower our healthcare costs.
Got it. Thank you so much. I want to turn back to Representative King. You recently sponsored a resolution calling for comprehensive care for individuals suffering from sickle cell disease. Why is this important for public health?
Let me just say, I have an observation. We are dealing with DEI in South Carolina, and I want to say one of my arguments was how Black women lead. And looking at this panel today, it proves my point. So I'm impressed. But let me just say, sickle cell disease is one of the most common genetic disorders in the United States, as many of us know. Yet it is also one of the most overlooked. It primarily affects Black Americans, and for far too long, the disease has been neglected by our healthcare system. So let me just a little bit background. I have two nieces that suffer with sickle cell, which made me very concerned about treatment and different things that they were getting, and I saw the inequities in our system. And so a lot of times the healthcare system is underfunded when it comes to sickle cell by our research institutions, and is misunderstood by policymakers, is what I found out. That neglected, the neglect of it is just a failure of the healthcare system in the United States. And it's a failure of justice to those individuals who suffer with sickle cell. When we talk about public health, we're talking about equality. And there's nothing equitable about the fact that people living with sickle cell are often forced to fight through critical pain, discrimination in an emergency room, and limited access to specialized care. These are some of our sons and daughters, and like with me, my nieces, and our neighbors, our constituents, and they deserve better. And so a comprehensive care means addressing not just the physical complications of the disease, but the mental health toll, the social barriers, the economic challenges that these individuals face that comes with just having the disease. It means we have to invest in research, ensuring access to new therapies, and training healthcare providers. Is what we are finding, that a lot of the healthcare providers are not trained to deal with sickle cell patients, and especially with dignity that these individuals deserve. The resolution makes sure that sickle cell patients are no longer invisible. And so it's about saving lives and saying clearly and unequivocally that Black health matters. And if we are serious about public health, then we must be serious about people who suffer with sickle cell. And it's near and dear to my heart because I do have two nieces that suffer with sickle cell. And it has been something that has been my legislative agenda every year, is to ensure that people who suffer with sickle cell are noticed and are taken care of.
Thank you, Representative King. And I like that you are bringing in real solutions that are applicable, that you have real life experience with. A lot of times we see legislators put forth policies and procedures that they're not really close to the problem. But when you're close to the problem, you are best equipped to be prepared to address the solution. And so I just want to, give you your hats off for identifying something that has been affecting you, or people that are affected by it, and working immediately in your role as a representative to address it so that it affects all South Carolinians. So thank you for that.
And I appreciate it. And please excuse me not being in the office and the attire that I have on today. I am not feeling well, suffering with allergies, but I wanted to make sure that I fulfilled my obligation of being here today.
Absolutely. Thank you so much.
Thank you.
I want to go back to Kaylin. Kaylin, we have a new Secretary of Health, and this gentleman has had some very controversial stances around health equity, particularly around reproductive justice. At your organization, all above all, how does a new Secretary of Health, who maybe shares a different lens than previous secretaries, affect particularly reproductive justice? And you spoke about abortion in your opening remarks. How has this new leadership changed your approach in how you're going to continue sharing your message with folks who need that type of reproductive justice support?
Thank you. So thank you for that question. I want to start off by telling folks what reproductive justice is, because a lot of times folks are just throwing it out there. It's a buzzword. You're getting some grant money for reproductive justice, but folks don't really know the difference between reproductive rights, health, or justice. So Reproductive justice, is a framework created in 1994 by 12 Black women who came together after recognizing that the mainstream women's rights and reproductive health movements weren't addressing their needs, realities, or lived experiences of their communities, despite the fact that Black women and other people of color were often the most impacted. They envisioned a framework that was intersectional, community rooted, and grounded in human rights. And so, at its core, reproductive justice is the right to have a child, the right to not have a child, and the right to parent children in safe and sustainable communities, and the right to bodily autonomy, including gender expression and sexual pleasure. It's not just about access to clinical care, but about addressing the social, political, and economic conditions that shape people's reproductive lives. So, as someone who approaches public health through a reproductive justice lens, I understand that individual health outcomes don't exist in a vacuum. They're shaped by a web of structural barriers, things like access to abortion and the full spectrum of reproductive care, but also access to clean water. You have access to housing, food, and the ability to live free from violence and discrimination. And I also want to note that identity matters. So a Black college-educated queer woman will navigate the healthcare system in the world very differently than a white woman without a college degree. When we ignore those nuances, we fail to design public health solutions that truly serve everyone. And so when we talk about public health and reproductive justice, we are really talking about building systems that center the people who are most impacted and ensuring they have the resources and autonomy to thrive, not just survive. And that is really going to be like my theme word is like thriving. We are tired of surviving, y'all. And so I did want to point out that NBCSL, I know you're talking about like the secretary and their views are different than like most of public health professionals' views right now. But I did want to highlight some of the work that NBCSL has been doing in this space. And so over the years, NBCSL has sponsored several resolutions that are rooted in actual reproductive justice. You guys have resolutions supporting access to contraception and comprehensive reproductive health services. Calls for policy that protect reproductive freedom. Another resolution that focuses on improving maternal health outcomes and addressing racial disparities. And lastly, another one that advocates for gender pay equity to reduce poverty among working women, recognizing the economic dimensions of reproductive justice. So these aren't just symbolic gestures, they're actual like power building tools. And in today's federal political climate, where protections are being stripped away and courts are increasingly hostile to reproductive rights, state legislators are on the front lines right now. Resolutions like these help set the tone. They put pressure on local governments and state agencies to not only act, but to also show up in the communities that we are listening and responding to their needs. But more than that, resolutions lay the groundwork for future legislation, funding, and education. And just to wrap this up, I want to note that resolutions create momentum. And we need to use the momentum not just to acknowledge the importance of reproductive health and rights, but to advance real concrete policy change at every state level. That includes bills, budget investments, and continued community engagement, because ultimately, reproductive justice requires more than access, it requires power, and these solutions are one way to begin to build it.
Thank you so much, Kaylin. And I want to turn back to Delegate Price. Delegate Price, you are the chair of the Health and Human Services Committee for NBCSL. And I wanted to ask, in your role as a legislator and in your role as the chair of this committee, how important is it that NBCSL is leading on health and making sure that the proposals and the resolutions that the organization is putting forward is being shared across the country, but also how does that translate back into the work that you're doing in the state of Virginia as you also sit on these subcommittees for health professions?
Yeah, I really appreciate the question. So I have been a legislator since 2016, and really got involved with NBCSL in 2017. And I am so glad I did, because hearing Representative King talk, it reminded me within our sessions at the conference, but just even being put in touch with each other, we are all fighting some of the same battles and some of the same policy issues. So, some of the work being done here in Virginia for sickle cell, Delegate Candy Munding King, can be in touch on that, and just making sure that we are all feeling connected. And so it is a bipartisan effort, right? As the global NBCSL, but really being able to create bonds and networking so that there is a national focus. But then, as I was hearing Representative King talk about South Carolina, Virginia luckily is in a little bit of my words, better position, because we have folks that are running the House and the Senate that care about Black communities. We have our first ever Black Speaker of the House, Don Scott, in Virginia, that is helping set the tone and is allowing for members of the Black Caucus to really take, center stage when it comes to amplifying issues of Black maternal health and sickle cell and some of the disparities that we're experiencing. We also have the first ever Black chair of Senate Finance and Appropriations. And then there's the chair of the House Appropriations. So the two main people that are leading the conversation on how Virginians' tax dollars are being spent don't have to be convinced that there is a Black maternal health crisis. They don't have to be convinced that HBCUs need funding in order to create pathways for more Black doctors and Black nurses and technicians within the healthcare system. So when we come to the table, we are coming with a lived experience and understanding. So when Rep. King was talking about his family members with sickle cell, he doesn't have to read up on it. I mean, he is, because he's, going to do his work, but he comes with the knowledge. I come to the table as one of the many Black women experiencing polycystic ovarian syndrome. So when my sister is talking about reproductive health, we know it's not just family planning. It's also, I need access to contraception so I can leave my house and do my work. So it's this global representation that we bring in making sure that people know that there are Black legislators who are fighting for you, no matter who you are, who you love, or where you've been in life, but also this network that we can create because we're doing the work on behalf of real lived experience. And so I just think that, the more than 700 Black state legislators that come from the 49 states, as we get together in these spaces and we are amplifying the work, we are also boots on the ground here in our local area. And so, especially as Black organizations are coming under attack from many different angles. We were just at a colloquium I was on with two other members of NBCSL at the invitation of NBCSL to talk to the National Medical Association. So now we have networks with, okay, how are we teaching doctors, Black doctors, how to show up and fight within the state legislative making bodies and rooms and share their experience on behalf of their patients, right? So this is the work that we're going to have to get back to the playbook of the Civil Rights Act, the Civil Rights era. We know what to do. We just got to do it. And we just have to make sure that we do not comply in advance with any fascist or white supremacist regimes, and that we are continuing to do the work on behalf of all of our constituents.
Thank you so much, Delegate Price, for that. That was a real rallying cry at the end, just around what sitting members across all legislative bodies can do and should be doing as it relates to health and pushing forth health equity. So I really appreciate your comments there. I want to turn back to Jasmine. We've been talking both with obviously state legislators and then practitioners and folks who are knee deep involved into this work. And one of the things that I wanted you to share with the audience and just touch on is resolution HHS 2516. And what is it and why was it important for that to actually become a resolution?
Absolutely. Thank you for that question. So NBCSL did pass resolution HHS 25-16, mouthful. And this resolution underscores the importance of both financial and social support from parents and how it, especially fathers, and how it affects children, their upbringing, and their ability to thrive. And we know at the American Heart Association that supporting families is always a smart investment. The resolution also has a call for child health equity task force. And I think that is amazing. And it's a timely, powerful solution to ensure that children in your local areas have a fair opportunity to thrive in life. And earlier you asked what our organization is doing to help parents and families. And what I did want to highlight, especially for legislators on the line who are in these 5 states, at Voices for Healthy Kids, one of the ways that we're doing this is we're supporting community organizations, through targeted funding and partnerships. And we're doing it in 5 states. In Alabama, Arkansas, Florida, Mississippi, and Texas. And this is a targeted effort to improve the policy environment for children and families in these states in particular. Excuse me. Can y'all hear me? Am I frozen? Okay, wonderful. Thank you. So these grants, these small grants, are designed to help organizations strengthen coalitions, build grassroots power, and directly engage community members and lawmakers in a meaningful way. And this is just one of the ways that our organization is really investing and putting our money where our mouth is to ensure that parents in these states aren't navigating these challenges alone.
Thank you so much, Jasmine. Really appreciate those comments and sharing more with the audience about what HHS 2516 is. And I want to stay with you. And this is a question to everyone on the panel, but just I'll ask you first. What is one action that folks who are watching this today can take to help advance public health? What is something small or big that each individual person can do to advance public health?
Thank you for that question. So I can't stress it enough. The future of our youngest generation is being shaped today. And when we make investments in babies, we are investing in a brighter future and a brighter tomorrow for everyone. So the issues, it's a long list, but for right now, I really do want to focus on access to care and what folks can do in that area. And so this is a defining time and a defining moment in fighting for quality, affordable healthcare for all. So at stake are massive cuts to federal funding for Medicaid and the elimination of tax credits that make health insurance affordable for millions of families. But this is a battle that we can win, so it's not all doom and gloom. And research does show that there is widespread opposition to to these cuts that will terminate healthcare for millions. So in your role as policymakers, advocates, or staff, we must do what we can to protect our healthcare and ultimately stop the cuts to Medicaid and extend the tax credits. Thank you.
If others want to chime in on what's one thing that folks can do, either a big step or a small step, to advance public health. And I can call on Representative King.
Folk in the room can take from today is to use your voice loudly and consistently to advocate for equality in every public health conversation, whether you're a policymaker, healthcare or education, or just a grassroots organizer. Don't shy away from naming the disparities, calling out the negative, and demanding targeted investments in the communities that look like us. Public health doesn't advance in silence, I don't think. It moves when people speak. So I think we have to speak up and speak truth to power when they show up to school board meetings, legislative hearings, or community forums. We want you to speak about the disparities that we have and advocate. Advocacy is contagious. So when people see you advocate, they will advocate as well. So when you speak to others, feel empowered to speak about it, to speak about the disparities, but use your voice is what I would leave from the conversation today.
Thank you so much, Representative King. Kaylin, is there one thing that an action that audience members can take, big or small, to advance public health?
Yes, thank you for that question as we close out. I would say one thing I'd encourage everyone to do is to get involved at the state level. The state and local levels is where the power is. We see what's going on in the federal lens, the federal landscape, but we can do so much on the state and local level. That's where we have the most immediate impact. And at all above all, like I said, we launched our inaugural abortion justice playbook, which lays out bold, actionable policies that lawmakers, advocates, and community members can push in their own states. So it's truly a tool that is designed to help you connect the dots between reproductive justice and broader public health goals. And whether it's expanding Medicaid coverage for abortion care, protecting data privacy, supporting doulas and midwives, or ensuring access, comprehensive access to maternal health services, there are real tangible policies that folks in this room can champion. So you don't have to do it all, but everyone has a role to play. Public health just isn't about systems, it's about people. So talk to your legislators, as we have so many legislators here, joining us. And NBCSL is a great is a great organization to work with, so you can have those conversations with stakeholders like legislators who are making those policies. Connect with grassroots organizations, or even host a community event. So just start somewhere, because when we all take action, we move closer to a world where everyone has when everyone has the right to truly thrive.
Much, Kaylin. And I would like to also give Delegate Price the opportunity to chime in here, just to share with anyone that's watching, what's one action, big or small, that we can all take to advance public health?
So I'm going to start off with an example as to why this action is so important. So I have a lot of people that will write in to support a bill, or will speak at a meeting to support a bill, and then the bill passes and then they check out. But let me give you an example as to why we have to stay engaged for the entire process. So I had a bill that was based out of the Virginia Commission to End Hunger. And basically it was just saying that this particular department was going to convene a work group in order for us to get usage of SNAP programs and federal funding in order to best get to making sure that all of the programs were being utilized, and the outreach was done so that everybody knows that the programs exist and all of the eligible people had signed up. Simple bill, bipartisan support, sailed through. We get to the last process, and the governor has added an amendment that rewrote it and took out all of the parts that would have collected demographic information because of anti-DEI sentiments. And so now we have a bill that basically doesn't do anything. Come to find out, in Virginia, 8 out of 10 of the most food insecure localities are in white, rural Southwest Virginia. And so his attack on DEI was actually hurting other folks. But a lot of people just assumed that when the bill passed, it was going to become law. But that governor's signature is the last part. So I would say, as you're engaging in the legislative process, there's the state, there's the federal, and the local levels, 3 different levels, but it's also the 3 different branches, and you have to follow the whole way through. So for instance, for that bill, now the governor has until May 2nd in order to veto or sign the bill. I'm gonna throw in another one too. If you have not applied to be on local or state boards and commissions, that is another area where you can actually do hands-on work. So the Commission to End Hunger in Virginia has legislators and residents that are on it and are doing really great work. And lastly, I'll just say, and I know we are a nonpartisan organization, so I'm just gonna say it like this. If there are folks who are basing decisions based off disdain for science and disdain for difference, then their seats need to be changed. And you can sign up for campaigns and fight for candidates who believe in your public health goals. In Virginia, we have some major campaigns that are happening right now. And so tap in for that, or help fund legal organizations that are fighting for your beliefs and your values within some of these lawsuits, in order to make sure that that equity is still within health, and that public health has the element of justice as well.
Thank you so much, Delegate Price, for reminding folks that you don't have to be an elected official to serve and to give back. And I think the mention of serving on boards and commissions is very apt for this conversation. I want to just kind of bring us to a close, and that we've been having this conversation around public health across America. This is our On the Issue series with NBCSL. We want to thank all of our panelists. Again, Delegate Price from Virginia, Representative King from South Carolina, Jasmine Hooper from the American Heart Association, and then Kaylin Turner from All Above All. Thank you so much, all of you, for participating. For those who are watching, just a reminder that we will continue having further conversations like this, further series like this in the coming months. Also, as a reminder, the annual legislative conference for NBCSL will take place this year in Biloxi, Mississippi, and those dates are December the 7th through the 12th. We hope that each of you will plan to attend, and we look forward to having future discussions around On the Issue topics. Thank you so much.